उत्कर्ष, डॉक्टर बांदेकर, डॉक्टर गीता आणि प्रायव्हेट सेक्टर IMH आणि बाकी सगळे डॉक्टर्स. After interacting with them, basically we see that the number is still very small. But the whole idea is to interact and see what is to be done, what are the type of symptoms people get, and ultimately try to understand. There is no reason why people in Goa should panic. This meeting was not to create any kind of a sensation or a panic in the minds of the people of the state of Goa. But the whole idea was also to see what is the level of vaccination in terms of the students and students that we have taken. Also to assess and appeal to the people, those expert committees, viewers, everybody should wear masks. Wear masks wherever they go in crowded places, public places. They should mandatory wear. Government can't always bring rules, regulations and सक्ती केल्या म्हणून लोक पाळटा म्हणून तसे नसतं. ते प्रत्येकाने आपापल्या जीवनाची काळजी घेवपाची गरज आहे. आणि त्याचबरोबर we feel that when you travel in a plane, you realize that the air hostess doesn't allow to sit on the seat till you wear a mask. So it's up to you as a individual and a citizen, appeal from the expert committees, wear a mask, social distancing, and त्याचबरोबर जे तुमचे elders जे घराना जे precautionary dose खातीर eligible are, I think those people should come. We have educated people in the state of Goa. We are not an uneducated state. We have one of the highest literacy rates in the state of Goa. So same way, if they have parents, you have your elders at home above 60, it is up to that family to make sure that the elders are brought to the center. Government is giving this vaccination free, and it is also available in some private hospitals. And same way, it is important, it is my appeal to all the people in the state of Goa and all the younger generation, your parents, your elders, your grandparents who are eligible for this precautionary dose, please make sure that they take this precautionary dose. Because as we were discussing among the experts, there was also a discussion saying that how does the virus, when it affects a person who is above 60 or maybe having comorbidity, but this immunity of every person is different. So it can affect a person in a different way. Sometimes it can even lead to mortality. So it is very important that a person takes the precautionary dose. This precautionary dose has been provided to the people of the state of Goa by our Honorable Prime Minister Shri Narendra Modi ji. Under his government, we have got all these vaccinations free of cost. And same way, we are also seeing that total stress is given on the vaccination of the students from the age of 12 to 14. Already 12 to 14, first dose, the total number of students segment in that has been first dose around 32,066, that is around 66.25%. Second dose is 48.37%, is amounting to about 23,412. Madi vacation be ashillo, so now in the schools our teams will go and they will vaccinate the students. It's very important. And same time, vaccination of people above 60 also is very important. Vaccination of 15 to 17, first dose was around 69,324, that's around 93.68%. Second dose is around 59,629, that's around 80.58%. And above 60, it's come to around 47.33%, it amounts to around 58,862. म्हाका दिसता कितें क्लॅरिफिकेशन बी आसल्यार डॉक्टर बोरकर दितलो, पण त्याच बरोबर आमी कितें थरयलां की इवन प्रायव्हेट डॉक्टर्स जे पेडियाट्रिशियन आसले, there are few pediatricians and doctors who have been a part of the expert committee for so many years, for the last couple of years, and basically their view also was not only in pediatric hospitals but also in their clinics we should allow them to give the vaccination, which we have said that they should be allowed to give, and there is no restriction of that, they will be allowed to give. So that will be one of the recommendations of the expert committee. So I think everybody was unanimous on that should be done. So only thing is, from the media, it is important for us to stress that people above 60 should come forward to take the vaccination. Government is making all efforts to take this forward. Even if there are groups of people who want to get together and if they want a team to come to a particular place and take the vaccination, then we will make that arrangement and see that this vaccination is provided. If people are mobilizing people of that segment and telling us, then we will make sure that our team goes to that particular place and we give the vaccination. Door to door also help for elderly people, wherever it is required where people can't come, we will make sure that the teams from our hospital make sure that we attend to that particular patient and we give the vaccination. It is important that these things through the media and through all of you, it goes to the public that it is important that this precautionary dose must be taken. Again, once again, the segment from 12 to 14 thrust will be given, 15 to 17 thrust will be given. We will reach 100%. Now that the schools are reopening, I don't see any difficulty in our teams going and giving the injection, and it is important they have this vaccination. We complete the segment for students, but same time above 60 is important because nobody knows. Because what we were assessing and discussing is that the virus today is at X, but we don't know whether it will further mutate, whether how it will behave. So as a result, we thought that it is important that we have this deliberation. I also wanted to be a part of the deliberation to understand exactly what people feel, what the experts feel, so that I as a health minister also have little knowledge of what is actually going on and what we need to do. But as of today, we don't feel there is any reason for any kind of knee-jerk reaction. But it is important that all of us start wearing masks. Wherever we go to crowded places, wear the mask. Public places, wear the mask. Social distancing. This is the need of the hour. And to ensure, I think all of us are in a position to ensure, if everybody, if like children at home or the younger, the youth in the house, make sure that their parents get their vaccination done, I think that we'll be able to achieve 100% in no time. It's up to them. Ultimately, then we always have a tendency to regret a decision that we don't take. Because tomorrow, if you lose somebody who your loved one because say you get COVID and that COVID has an impact on your life and you leads to mortality, then why do you want to regret? It is because we don't know how this virus behaves. It's ultimately a virus. It has mutated so many times, and as a result, it is important to people above 60 take these precautionary dose, which has been provided free of cost by the government of India. That's all for today. Only this we thought we should share with you, and we should take this forward with the support of the media to make this message penetrate into society, so people support us in this endeavor to achieve 100% vaccination.
Specifically, टीका also केलं. Response was not.
नाही, रिस्पॉन्सचा प्रश्न आहे. तुम्ही काय कोणाला फोर्स करू शकत नाही. आम्ही तुमच्या माध्यमातून आम्ही लोकांना सांगू शकतो ही परिस्थिती आहे. आज एक्सपर्ट कमिटीमध्ये हे डिस्कशन झालं. त्यांचं मत असं होतं की जे कोण इंजेक्शन घेत नाही अबाव 60 कोमॉर्बिड जो माणूस असतो त्या कोमॉर्बिड माणसाच्यावर कसा इम्पॅक्ट व्हायरस होतो तो एक माणसावर वेगळ्या तऱ्हेने होणार, दुसऱ्या माणसावर दुसऱ्या तऱ्हेने होणार, तिसऱ्या माणसावर मॉर्टॅलिटी होऊ शकते. म्हणून वी शुड बी व्हेरी कॉशियस अँड टेक ॲडव्हान्टेज ऑफ दिस वॅक्सिनेशन प्रोग्राम विच इज बीइंग रन बाय द गव्हर्नमेंट.
बुस्टर डोस आधी किती झाले?
चांगलं नाही आता सगळं सांग.
पण लोक पुढे येणार
लोकांनी पुढे येवपाची गरज आहे. सरकार काय लोकांक वचून उपटून हाडूंक शकना. लोकांक आमी फ्री इंजेक्शन दिता. आमच्या देशाचे प्रधानमंत्रीन आमकां एक राज्य एकूच देशात जगान जे खंय आमी फ्री वॅक्सिनेशन दिता. पीपल शूड कम फॉरवर्ड. वी विल आय जस्ट मेड अ मेन्शन दॅट इफ पीपल इवन फॉर्म अ ग्रुप ऑफ एलिजिबल बेनिफिशरीज and eligible segment, we will send a team there and vaccinate them. But people should come forward.
मोस्ट प्रॉब्ली लहान भुरग्यांचे
पेडियाट्रिक क्लिनिक्स हॉस्पिटलान आसाच, पण पेडियाट्रिशियन्सचे क्लिनिक जे असतात थंय बी आमी दिवपाक परवानगी दिली.
ल्हान भुरग्यांच्या स्कुलान वयता जाल्यार तांकां सेव्ह करपा खातीर कोविडाचेर तेंचेर कितें उपाय?
खंयच्या एज सेगमेंटाचे उलयता?
सारखे ते अपर
पण आता ते आता सेगमेंट जो गव्हर्मेंट ऑफ इंडियान जो पास केला इज ओनली बिटवीन स्टार्टिंग फ्रॉम 12. अनलेस द गव्हर्मेंट ऑफ इंडिया गिव्स अस परमिशन टू डू एनी काइंड ऑफ दे डू देयर रिसर्च अँड अदर थिंग्स अँड गिव्ह अस परमिशन, वी कांट डू एनी.
सर, नेबरिंग स्टेट लायक महाराष्ट्र, कर्नाटक थंयसर तीस चड वता आणि ते म्हणजे आमचे टुरिझम संचालित करता. सो अशा वेळार कितें चॅकिंग अशें आसतलें?
सध्या काय ना, सध्या आम्ही मास्काचेर लक्ष दिवंक जाय, सोशल डिस्टन्सिंगाचेर दिवंक जाय. सगळीकडे नी जग रिएक्शन केल्यार काय जाता. आमी ते प्रत्येक राज्याचे पळयलां, पीक कसो वयर वयता, फ्लक्च्युएट कसो जाता, परत देंवपाक चालू जाता. सो मातसो ऑब्जर्व केल्यार बरें न्ही. बेश्टें नी जग रिएक्शन कितेंय केल्यार कोविडांतल्यान आतांच भायर येता. मनस्थिती लोकांची आतांच बदलूंक लागल्या. पण त्याच बरोबर आमी सगळ्यांनी कॉशियस रावपाची गरज. जे कितें प्रिकॉशनाचे जे संदेश सरकार दितात ते संदेश ताका सहकार्य लोकांनी केल्यार खूब बरें जातलें. म्हणजे आमी लोकांचें जीवन आमी सुरक्षीत दवरूं शकता.
So next 45 days, like in monsoon session, the vector-borne diseases are increasing. So will there be extra additional beds which will be kept?
We have enough beds.
Sometimes
Where you have found that there is no bed?
No, sometimes it is overwhelming.
No, I think now with the super specialty hospital getting slowly commissioned, there is beds, enough beds are available. I don't know who has told you that there are no beds, but beds, ample amount of beds are available. We are slowly commissioning the super specialty hospital. There again, the beds will be there. We are also making sure that we go in a phased manner so that we have specialities that we want. I have already said that we want to start robotic surgery, we want to start neuro, or we want to start neurosurgery in South Goa District Hospital, Unit 2 for cardiac in South Goa District Hospital. Here we want to start. We have taken Dr. Amit Maideo on board. We want to start a department of gastroenterology. And main thing is to train our doctors. We have made him the head of the department of gastro, so that people who had to go out, they don't have to go out. I will going to speak to the Honorable Chief Minister because we have our tertiary cancer center work is going to start. So which was pending, elections झाले आणि काय गोष्टी झाल्या, so that also hospital once it comes up, it will benefit us in a very big way. म्हाका दिसना काही बेडाची शॉर्टेज बी जातली असं आमच्याकडे
जीनोम सिक्वेन्सिंग मशीन
चालू झाले नाही ऑलरेडी. डॉक्टर्स कोण पळयता ते जीनोम सिक्वेन्सिंग
60 चालूच आसा इंदोर गोवा डिस्ट्रिक्ट हॉस्पिटल आणि
केलें
रेग्युलर चेकिंग चालू आसा.
Yeah, of course, we are checking now everywhere. We are also taking, you saw my statement, no? We had a meeting with the health services as well as the chief officers. And we have also said that under G Suda will give them the machine, foggers, everything, so they utilize their staff where they can work together. So we being the minister for both urban development and this, I think everywhere the municipalities and these are taking interest in doing it. So if anybody brings it to our knowledge, we are, and also health officer, particular health officer is keeping a watch on those respective areas.
सर आता जे होम आयसोलेशनान जे आसात कोण कोविड पॉझिटिव्ह तांचे सिम्पटम्स कितें चड आसा काय मायल्ड सर?
एकदम मायल्ड असं एकदम मायल्ड आहे म्हणजे बॉडी काय कळा बी ना केन्ना केन्ना.
ओके.
आमच्या मदीं आतां कोणाक कोविड आसल्यार बी कळचें ना म्हणून ते वेगळें दिसलें जाल्यार वचून टेस्ट करपाचें आहा. पण आतां केंद्र सरकारान बी सांगलें टेस्टिंगाचेर भर दियात. टेस्टिंग करपाची गरज आहा. तुमकां जर दिसता की बॉडी वेगळ्या तरेन तुमकां दिसता, यू गो एंड चॅक युअर सेल्फ. It is always good, so you can take that course of medication and you be done with, and it's not more than 5 days isolation. 3 to 5 days होता सगळीकडे.
बायोस्की आणि एंडोस्कोपी कित्याक करिना स्टार्ट कित्याक करिना?
स्टार्ट करपाक डॉक्टर ऑन बोर्ड आतांच आयला. सरकार गव्हर्मेंट हॅज टू स्पेंड अबाउट 14 crores on that, at least 10 to 14 crores on the full facility infrastructure. I am the one who pushed that proposal to bring the doctor on board. मागीर कितलेही क्वेरीज तेजेर आशिल्ल्यो त्यो क्वेरीज आन्सर करून कितें आसता सरकारान जेन्ना नवें कितें सुरवात जाता तें एक्सप्लेन करून सुरवात करची पडटा आनी टायम लागता. तें हांव काय ताबडतोब म्हाजे कडेन एक सिग्नेचर आसल्यार गोश्ट वेगळी, हांगा 10 तरेचे सिग्नेचर मारले उपरांत मागीर फायल क्लियर जाता.
आयस्टॅग मशीनां तुमी ना आयस्टॅग?
हय, आयस्टॅग मशीन आमचें लक्ष आसा. ते प्रत्येक सब हेल्थ सेंटरान सद्या आमी कितें केलां, आमी वाळपय, पेडणे आनी काणकोण हांवें तिका सांगलां की CSRच्या माध्यमांतल्यान आमी सद्या आमी प्रोवायड करता. मागीर आमी ते पायलट प्रोजेक्ट रन करून आमी पळयता म्हणजे स्थानीक गांवच्या मनशाक सब हेल्थ सेंटर पर्यंत दिवपाची गरज पडटली. बेसीक टेस्ट करून घेवपाक, शुगर्स, लिपीड आनी तुमचे
युरिया
हय ह्यो सगळ्यो गोश्टी थंयचे थंय तुमी करूं शकता. म्हणजे ताका PHCन बी येवपाची गरज पडटली. साखराचो ब्लड शुगर बी टेस्ट करपाक तो थंयचे थंय वचूं शकता. ग्लुकोमिटर आसात पण सगळ्यांक काही ग्लुकोमिटर पावना, थंय वचून तो चॅक करूं शकता. आतां तुवें जर गांव दवरल्यार आमचो एक तुका उदाहरण दिता, समज करंजोळ कुमटळ, थंय सेबल सेंटर कुमटळ आहा, थंयच्यान ते लोक थंयच्या थंय वचून ते चॅक करूं शकता सकाळ फुडें. तांकां तें सोंपें पडटलें. त्याच तरेन ऑल गोवा हे रेप्लिकेट जावंक जाय.
सर टेस्टिंग कॉन्टॅक्ट ट्रेसिंग सेम प्रोटोकॉल फॉलो
ना, सध्या
करता सिम्पटम्स आले का?
जो कोण पॉझिटिव्ह जाता ताका आमी होम आयसोलेशन ताका आनी कॉन्टॅक्ट सिम्पटोमॅटीक कॉन्टॅक्ट मिन्स जो सिम्पटम आहा त्या तरेच्या मनशाचे आमी टेस्टिंग करपाची गरज. नाल्यार कित्याक जाता ते जस्ट एक्सरसायज इतलो व्हडलो जाता ते गरज ना सध्या. आनी आमी जे प्रोटोकॉल फॉलो करता गोंया राज्यांत, केंद्र सरकार जे आमकां गायडलायन दिता ते करता. जगभर आता तेच चल्लां सध्याच्या परिस्थितीत.
आता सर जे होम आयसोलेशन आहा पळय, आता ते सगळे गोव्यात दोन्ही डोस जाला तेंचे का कोणाचे अशें जावंक नाशिल्लें अशें कितें नोट जालां तुमकां?
ज्यांचे दोन्ही वॅक्सिन्स घेतले ते तांकां पुन्हा कोविड
जाल्या थोड्या लोकांक दोन्ही वॅक्सिनेशन
चडशे जाल्या
चडशे जाले. वॅक्सिन दिता म्हणून चडशे.
हय. चल थँक्यू.
विजय